Bore da and welcome back. I hope that you had a refreshing break and are ready for the session 2 on building will. I'm Dr. Stacey Harris and I'm a paediatric registrar here in Wales. And from September, I'll be the next Leadership Fellow in Sustainable Healthcare. And I'll be standing on Amarantha's giant shoulders and taking forward all that she's built and created and connected over the past year. I hope you're enjoying the conference as much as I am. And as a paediatrician, I feel compelled to look at the bigger picture and to advocate for children like the one we've just heard about in the video during the break and our future generations. There's much work to be done and I can't wait. There's already been a lot of transformative progress made in healthcare in Wales, and that's due to the dedication of individuals and groups across Wales to change the way that healthcare is operating. People have stood up, sat up and spoken up, and they've used innovation, collaboration and courage. And in Wales, it's small and nimble, and we're leading the way. In this next session, we'll showcase some of what's going on in Wales. So it's my pleasure to have the opportunity to introduce these inspiring speakers for session 2. So first up, we have Thomas Downs, Yasmina Hamdaoui and Gwenllian Rhys. They're junior doctors and Yasmina Hamdaoui is a pharmacist, and they work together in Ysbyty, Gwynedd and Bangor. Tom founded the Ysbyty Gwynedd Green Group during his first foundation year, and Gwenllian and Yasmina have been working with him as the Green Group Committee since it was established 2 years ago now. From making connections in their local hospital, they've now set their sight on changing the sustainabilities of hospitals across Wales as part of the Green Health Wales Foundation Group. Thank you. Over to you.
Thank you, Stacey. It's a real pleasure to be here with my colleagues Gwen and Yasmina on behalf of Ysbyty Gwynedd Green Group. What I hope to talk about today is how we started, what we've learned and what we've achieved. So this is the context which my cohort of doctors started our medical careers. So this is the summer of 2019. I'm graduating from medicine at Cardiff, but it was also the summer uprising for Extinction Rebellion, and there's been raised, the awareness of climate change was raising just prior to this. The Welsh government had declared a climate emergency. So this is the context at which I started working, doing my first job at Ysbyty Gwynedd in Bangor, and I wanted to know what I could do, and I didn't really know where to start. I started reaching out to colleagues, and they encouraged me to apply for a project with the Bevan Commission. So my project was called Making the Connections to Improve the Environmental Sustainability at Our Hospital. And that initially started as conversations with the junior doctors. And what we did was we set up a stall in the hospital corridor, and we had a board to collect people's ideas, and it was a really good way to engage with people. And by the end of the day, we had loads and loads of ideas of things that we could do to improve the sustainability at the hospital. So from this, we then had a group of us that then we could start having meetings with. So then we started having some meetings. This is us at our third meeting. And I think what's really important to highlight is that this is a really big multidisciplinary team. It's not just clinicians, it's across the board. So it's not even just clinical staff, it's non-clinical staff as well. And at the moment now we've got about 80 members in the group. So it's just, that's the context of making connections. And it took us a while to get to sort of a framing of how to work, and this is what we've ended up coming to. So starting off connecting with the pockets of people across the hospital that are already doing things and bringing them together, then we're able to learn more about what we can do, and finally we can then transform the way that we do things and start implementing some projects. So I'll hand over to Gwen now.
Okay, so as well as making the connections with clinical and non-clinical staff within the hospital, we've also connected with lots of external organisations. So last year we were featured in the NHS Sustainability Impact Report on our work with staff engagement, and the Future Generations Commission Office has recently published a case study on our group as well. Last year we also gave interviews to BBC and S4C on the importance of a sustainable recovery coming out of the coronavirus pandemic. And that campaign is also something that's mentioned in the decarbonisation plan that we've been hearing about this morning. We were also really lucky earlier this year to attend the Spread and Scale Academy with Cardiff and Vale University Health Board and the Billions Institute as the only Betsy Cadwaladr group to do so, and that really gave us the tools to try and develop and scale our work further. With Learn, we recognise that we need to educate ourselves on what we can do to help deliver sustainable change within the hospital, but also to share that learning. And we've given a range of talks on climate change and healthcare, a local food sourcing project, as well as energy efficiency. We also publish a newsletter that goes out to all employees at Ysbyty Gwynedd, highlighting the important work that we and others are doing. Transform is all about innovation, and we've organised our project bank of ideas into sort of 6 broad categories covering clinical, energy, waste, transport, food and biodiversity. One of our dietitians has been working with one of our consultant members on a local food sourcing project, as well as on delivering increased vegetarian and vegan options in our canteen areas. Our anaesthetics department have gotten rid of their desiflurane anaesthetic gas machines, resulting in a massive reduction in carbon emissions from this particular source. We published last year a cycle to work guide highlighting routes for active travel to the hospital site, as well as storage facilities and locations on site. And one of our members has also been key in lobbying for showering facilities to be made available for staff, which are due to be opening in a few weeks' time. The hospital has also recently made the change to 100% recyclable paper. On top of that, we've also had a range of successful biodiversity projects, from installing planter boxes and flower boxes on the hospital site. And recently, we were also invited to the launch of a meadow walk between Ysbyty Gwynedd and the Iechyd Meadow, which is nearby, and that was organised by the Magnificent Meadows. And that's just the beginning. We've already got plans in place for 100 trees that were donated by NHS Forest to be planted on the site later this winter, as well as to expand the meadow areas on site. And the hope is that our mental health patients will be able to be involved in the upkeep of these areas, linking nature and well-being. We were part of a national reusable face mask pilot earlier this year, and we're looking forward to engaging with our infection prevention teams on delivering these alongside reusable face masks for our staff. We've also begun discussions with Energy Services Wales and the Carbon Trust, who are liaising with our estates team on delivering an energy efficiency plan for the hospital, which will cover renewable energy, upgrading the energy efficiency of the site, as well as possibly looking into installing electrical vehicle charge points and getting electrical vehicle fleets for the Betsy Cadwaladr Health Board. On top of that, we're looking to engage with the nitrous oxide audit, and obviously we've also been working on establishing Green Health Wales to take this work further on a national level.
Thanks, Gwen. So I'll talk about what we've learned in this journey and some of the lessons that we can share with everybody. So when we first started, we had so many ideas and lots of questions as well. And the first thing I think that we really benefited from is finding out what's happening. And I'd encourage you, if you're thinking of doing something similar, to reach out and find out what's happening in where you are. Do you have sustainability teams or environmental officers, and ask what they're doing? This helps you avoid duplicating any work, and also helped us be signposted to useful information such as our annual reports. And that's how we were able to really narrow down and choose which transformational projects to pursue. The second lesson is that sustainability really is on all of us. This is a chart from the NHS Wales Carbon Footprint Report, and it shows the emissions by source. And as you can see, there's work to be done right across the board. And just as sustainability can't be a responsibility placed on the shoulders of one single individual or one single department, we found that with any given project we wanted to pursue, we needed stakeholder engagement from various departments to succeed. So whether that was planting a tree or starting to look at nitrous oxide reduction, collaboration is always key. This is just an image of our initial logo when we first started, when Tom and Gwen took you back to the beginning, when Green Group was founded, and this is sort of what we've developed to now. And I think if I was to summarize this slide, I'd say that, we kind of started at the bottom and now we're here on a national conference. And I think the key take home from this is that you don't have to have it all figured out. None of us is perfect, and the whole, answering the call for a climate response to the climate crisis is massive. But it's all of us with our imperfect efforts and skills combined that can really bring about the change that we need. Ysbyty Gwynedd Green Group started with a few individuals. Tom was a fresh new doctor, and Gwen, when she stood at that initial stall outside the canteen, was sort of, you're kind of on your own as individuals, but by reaching out and being vulnerable, you will start to make connections, and together I hope we can show you that we've managed to make quite a lot of change. On that note, this is a slide that and an image that stuck with us from the Spread and Scale Academy that we were able to go to earlier this year, and we took a whole lot from that. And I think this is all about enabling change and making an impact in the universe. And to be honest, sometimes being in the NHS, it feels like we are in this great big universe and you kind of alone or up against it. And it's really difficult to make change in some ways, but there are tools, there are training, there are courses, and most importantly, there are other people who will help you along the way and support your work when the cause is one you're aligned to. And with climate change, we all have a vested interest. And with that, I'd also like to remind that we're here, the three of us, representing the whole of Green Group, and there's an awful lot of people who've helped us along the way, from our innovation leads to our consultants, to our members who attend every meeting, to our executives who have given us time at their meetings. So thank you, and we look forward to your continued support. If what we said today has inspired you and you'd like to know more about setting up your own green group, we have a vision of having green groups across hospitals in Wales. So please do get in touch with us. Our email address is on the screen. And please do come along to our webinar, which we are organising for September, where we'll tell you all about what we learnt in a bit more detail, because today was a very quick run through, and how you can avoid some of what we struggled with. So we'll share all the tips and tricks in setting up your own green group. The date and details are to be confirmed, but pencil in the 3rd week of September, and you can get in touch with us at this email address or subscribe to the mailing list on Green Health Wales to be notified when the details are all confirmed. And with that, diolch yn fawr, thank you.
How inspiring are you three leaders? It was absolutely wonderful to hear about your journey from something fairly small to this massive thing at the moment. And, it shows so much sort of promise for the future about what we can do if we work together. And you've made huge impacts on all aspects of sustainable healthcare, and that was lovely to hear. And you gave us some great lessons in which we can all take forward. Thank you very much. Next up, we have Alex Morgan and Farzad Saadat. They're both anaesthetic registrars living and working in Wales. They're members of the Welsh Environmental Anaesthesia Network and have an interest in all things green. So Farzad coordinated the national campaign in Wales to reduce the carbon footprint from anaesthetic gases. And they've both been lobbying the Welsh Government for a green recovery programme. And you may also have seen Farzad on BBC News Wales last year when he was promoting the cause. Over to you.
Hi everyone, I'm Alex. Lovely to see you all here today, and I'm going to have a little chat with you about the Welsh Environmental Anaesthetic Network. So I'm going to tell you a little bit about how we started. Essentially, it was a few corridor conversations, prompted a little bit by the lovely Dr. Fiona Brennan handing out green hats, which was generating a lot of conversation. What that meant is those of us that had an interest in all things green managed to connect and have little chats, and through that, we kind of developed this idea. We thought, wouldn't it be great if we had a network of like-minded people and if we could see if we could make a difference? And one of the projects that really came out of that first and really has helped cement the network and encourage us is Project Drawdown. And I'm going to hand over to Farzad and let him tell you about that.
Great, thanks, Alex. So Project Drawdown, this is just a quick explanation of this project that we did to reduce the carbon footprint from anaesthetic gases across Wales, and hopefully demonstrate how sort of harnessing the power of a green network can kind of maximise the impact of any project. Anyway, this started very simply, and it started with some scientific evidence that had been coming out in the previous 10 years that anaesthetic gases are actually quite potent greenhouse gases. And one of them in particular, desflurane, is about 2,540 times more potent a greenhouse gas than carbon dioxide. So we thought a sensible thing to do would be to present this information to the anaesthetic department at Cardiff and to encourage sort of alternative means of anaesthesia, reducing the carbon footprint from these gases. So that's trying not to use desflurane, running your gases more efficiently, choosing other gases or choosing other means of anaesthesia. And to do this, we made posters, which we put up in the anaesthetic room, and we sort of got everybody engaged. And at Cardiff, this was a relatively successful project, actually, and we got a little graph coming up. You can see, there it is, and you can see over time, the blue line represents the emissions from desflurane, which you see coming down over time. And the red line is the total emissions from total carbon dioxide emissions from anaesthetic gases. And so up to sort of month 13 there, there was a sort of 50% reduction in desflurane usage and reduction of carbon dioxide by emissions equivalent by about 40,000 kilograms per month, which was a huge impact. This was around the time that Dr. Fiona was setting up the Welsh Environmental Anaesthetic Network, and we thought this is a very replicable project. Why don't we get as much engagement as we can with as many hospitals as we can around Wales? So we got the engagement from different leads around different hospitals. So we got engagement from about 8 hospitals. We made a standard operating program, an SOP, which we put out, and other resources, presentations, which people could give to their local hospital. We made data collection tools, such as we made these sort of Google spreadsheets. So people just put in the amount of the different gases they were using each month, and it populated a central spreadsheet so we could see how well we were doing and how well we did. And actually we did really, really well. The total from just these 8 hospitals ended up being about 175,000 kilograms equivalent of CO2 per month in terms of reduction. And to extrapolate that to a year, that's about 2 kilotons. So to get that reduction from changing your diet, you'd need to cut out about 110,000 kilograms of beef from your diet. And I don't think any of our diets are quite that bad. So this is just a really quick demonstration to show that what started as a simple project at Cardiff became a really big project. I'm sure lots of people would have done this project in their own hospitals, but the fact that we were able to do this through a network had some real advantages. We were able to disseminate ideas to each other, sort of these collection tools, the standard operating program to each other really well. And see this in the next slide, hopefully. Oh, sorry. So we were able to spread ideas and feedback to each other really well. And so it maximized the impact across the entire region. And it actually also improved the impact at each individual hospital. So if you remember from Cardiff, we initially were able to reduce, this was where we got to just on our own. But we were then able to go back to our colleagues at Cardiff and say, look, at other hospitals, they've gotten rid of desflurane altogether. Why can't we do this? And then that stemmed a further drop in desflurane usage and carbon footprint to the much more minimal levels that you see approaching month 20. So networks are great, collaboration's great, and I'm going to let Alex tell you a bit more about what else WEAN is doing.
So we've developed over the last couple of years, but some of the things that we've started to put in place include we're aiming to do 3 to 4 monthly video meetings where everyone's invited, anyone can be there, and that gives us an opportunity to chat about what we're doing, where we've got up to, and float ideas. We're aiming to do a sort of 6 monthly newsletter, which again is a way of disseminating ideas and keeping people up to speed that perhaps can't make the meetings. And so far, for the last couple of years, we've run our annual conference. And I think the big benefit of the annual conference is the word cloud that you can see on the slide there. It's giving people really inspiration, and it encourages people to carry on. We're not alone, and we can encourage each other to continue to do good and improve things. Just to give you a little bit more idea about our vision statement and our mission statement. So we came up with these at our first annual conference. They're very much a collaborative approach. What we want to do is to embed sustainable practice as a norm across anaesthetic clinical specialities in Wales. And we also want to influence similar approaches across the UK, the EU and beyond. We want to take an approach to do no harm at an individual, community and population level to improve health for everyone, both now and in the future, which ties in quite well with the Welsh agenda. So our mission statement is to improve environmental and financial sustainability of anaesthesia across Wales. We want to provide education for staff and students around sustainable working behaviours. We want to share ideas, knowledge and innovations in order to support the implementation of sustainable practices. We want to provide a network, which we're definitely doing, so that's good. But we want to promote and share best practice. And I think most importantly, celebrate success. And we're doing this through a few different ways: community networking, research and projects. We want to work with management, we want a partnership with people, as well as educating. And also we are going to think about funding. We're quite well supported within our profession. The Association of Anaesthetists, the Royal College of Anaesthetists and the College of Anaesthesiologists of Ireland actually issued a joint statement as far back as 2017. So it is on our agenda. However, in the last couple of years, the Association of Anaesthetists has also employed a fellow in environmentally sustainable anaesthesia. And they've started an environmental champions network across the UK. And they were kind enough to ask us how we'd organised ours, which was nice. The Royal College of Anaesthetists says it's embedding environment and sustainability in the way it thinks about itself and the way it thinks about education. And they've actually done an e-learning module as well. They also have an environmental advisor and a college council head for sustainability. So hopefully all these things are starting to come together. In the future, what's in the future for WEAN? Well, we want to continue the good work with desflurane, continue collecting that data and encouraging people to make decisions that are sustainable and environmentally friendly. And we're also looking at total intravenous anaesthesia and how that may impact the environment and what we're doing with that. One of the recent projects to go out in the newsletter is thinking about prescribing oral versus IV paracetamol. So if we're using oral, is there a change to patient experience? Apparently not. Is there a change to the cost and environmental impact? Yes, and they're significant. So can we do that? We're hoping to make stronger links with other stakeholders. So pharmacists in particular are hopefully our biggest allies, but also other people that work in theatres and in hospitals. We're part of a very big system. Projects that are currently areas of interest: reusable laryngoscopes, thinking about recapturing those volatiles rather than putting them out into the environment, ethical supply chains and reusable linens. That is our whistle-stop tour of WEAN and where we are.
Thank you both so much, and how lovely it was that you connected initially through a really simple way of wearing green hats. And you've made absolutely huge impacts with reductions in CO2 equivalent. It's such an awesome, very simple project which has been spread through networking and connecting with others. And you certainly have a lot of success to celebrate, don't you? So next up, we have Sarah Williams, and she's a GP in Crookhowell, and she probably loves the Sugarloaf Mountain as much as me. And she's the Royal College of General Practice Sustainable Lead for South East Wales. And she's working to green map what's happening in general practice, and I'm sure she'll tell you more about what she's been doing. Thank you. Over to you, Sarah.
Thank you. So I'm a GP working in Crookhowell, and like many of us through the pandemic, overwhelmed and thought I need to be doing something more sustainable, and 2 young children, and thinking how can I make their future more sustainable, and really brought it home that we have to change. And it got me thinking, what can I do? And looking at my own speciality, so GP, we're actually really resource heavy. There's loads out there. And when you start looking into it more and more, there's more you can do as a GP. So I started Greener Practice Wales. And we're an evolving, growing network of GPs. There's 40 of us right across Wales involved in our network now. And so I think it's been a really exciting time for us to really sort of hit a crest of a wave and really try and bring sustainable healthcare into our daily practice. So thank you so much for inviting us here today so we can share our network. So sat there in my Welsh practice in the middle of the mountains, Brecon Beacons, and the Black Mountains. What could I possibly do that could have a global impact? And you would be thinking, I might have to move a mountain or carve my own stream. That, you know, how could I do that in my approach to individualised care for a patient sat in front of me? Well, turns out there's quite a bit you can do in GP that has a significant effect. So inhaler prescribing is a massive, massive carbon footprint emitting greenhouse gases. And there are greener inhalers that we can use. So a really good example of greener prescribing is looking at Ventolin. So you can see there on the slide, the carbon footprint of a Ventolin inhaler is 175 miles, whereas if you start looking at the Accuhaler below, delivering the same medication, it's down to a 4-mile trip. So if you start that kind of prescribing tomorrow, you're less than halving your carbon footprint. And some of you will know that actually maybe that inhaler switch isn't the easiest to do for everybody, as that type of inhaler isn't naturally what they'll be able to use as well. So a like-for-like switch would be starting Salamol tomorrow, already half the carbon footprint of a Ventolin inhaler. So we're really lucky as a GP network. We've partnered with some other working groups in Wales, so ICST, the All Wales Asthma Prescribing Group. So thank you, Stacey. Stacey was really fundamental in putting this together. And the carbon footprint of our inhaler prescribing in Wales is the equivalent to flying a plane to the sun and back per year. And we know that 98% of that is MDI inhalers, and they're the most, that they have the highest carbon footprint. So if we go back to that original slide, we know that if we start to use greener inhalers, which are just as safe as other inhalers, then we can really dramatically reduce our carbon footprint. So if we were to switch to predominantly DPI inhalers, we would less that carbon footprint journey in our plane all the way to the sun and back. You're talking more to the atmosphere and back, or even to just another country in 1 year. So these are dramatic changes. So in GP as well, we're thinking about our surgeries. There's 404 surgeries across Wales. And we know that 20 of those are at risk of flooding over the next sort of 20 to 30 years. So with the climate crisis as it is, we now have to think about actually what is the future of some of our general practices. And so we have an obligation to look after those. There's parts of Wales where communities' access to healthcare is largely to a general practice. I, for one, work in a health board where we don't have secondary care within our health board. It's POWIS. We just have primary care services and general practices. So, and why is it important that we start to change in GP and look at more sustainable healthcare options, particularly with inhalers? We know that there are about 2,700 deaths associated with air pollution in Wales. Lots of those would be based around inequalities, the lack of access to green space and fresh air, increasing the rates of asthma, and really honing in on our obligations to try and improve our asthma diagnosis and management. So why is Welsh primary care important to decarbonisation? GPs carry out 90% of all patient contacts within the NHS, so we need to have a decarbonisation plan of our own. The decarbonisation plan for NHS Wales is fantastic, and it's great to see that evolving. However, in primary care, we don't really have a decarbonisation plan of our own. Yet, if we look at the fact that primary care is holding 90% of all patient contacts, we're hugely responsible for probably a lot of prescribing carbon footprint and a lot of patient travel. So we need to develop our own decarbonisation plan. And as a network in Wales, we have started to look at what our main areas are that we should be looking to reduce our carbon footprint. So we have an estimate here of the carbon footprint of general practice, and you can see a large amount of that is actually in patient travel, but I would say that this doesn't include all of our prescribing, which is likely to be huge. And actually through the pandemic, you know, we revolutionised overnight within general practice and started a lot of telephone triage, and would have massively reduced our patient travel doing that. So our hotspots, as we've mentioned, so as a network, we've had our first meeting and agreed hotspot was definitely, as of tomorrow, we should start prescribing Salamol without a doubt. Another one would be e-prescribing. We currently do huge amounts of paper prescriptions, so we're now looking and voicing the need for an all Wales e-prescribing platform, which would massively reduce patient travel and transport, reducing printing. I mean, thousands of scripts go out of GP surgeries a day, and that's just one surgery. There's 404 surgeries. These are areas that we need to really voice for change. There's also social prescribing. This is using your social prescribers in your local area, a huge part of prevention and reducing the need to prescribe medication. And there's looking at the Impact for Health Toolkit, a great resource. You can access it, use it in your surgery, and it starts to decarbonise. Again, highlighting that the resources are there for GPs. It's just having the time to access it is probably our biggest barrier. And another big area is recycling. So if you're in one of our more urbanised areas in general practice, so Cardiff or Newport, have a look. There could be a Superdrug around the corner from you that's got a recycling service operated where people can drop off their medications, inhalers. It's a whole area that we're not really recycling very effectively, and this is something as a network we'd really like to look at, ways to recycle the huge amounts of medications which would be out there that are going into sort of general waste. And there are schemes out there, and it's knowing about them and seeing if they are accessible in your area, and if they're not, looking at ways in your own practice that you can start to, along with your local pharmacist, maybe encourage responsible recycling. So we're really lucky as a network. We've got lots and lots of support. We are partnered with Public Health Wales, so since our network has started, they've actually devoted a member of their team, Angharad, originally Victoria Hannah, just gone on maternity leave, to work alongside us, to help us develop our ideas and sustainable ideas that we can start to use more in general practice. And thank you, obviously, Greener Health Wales Today, a platform for us to raise our primary care voice. And the ICST, as we've mentioned, the All Wales Asthma Prescribing Guidelines. And we're lucky, the RCGP declared a climate emergency. I've become the RCGP Sustainable Lead for the South East faculty. So if there's any other GPs out there that have that interest, join your local RCGP, become a sustainable lead. There's huge resources out there, and lots of things that we could be doing to encourage sustainable healthcare within our surgeries. And obviously working with the Bevan Commission has massively improved our network and sharing those kind of ideas and how we need to sort of spread and scale has come from being involved with them. So some acknowledgements, obviously Helen Howson, who spoke this morning, and Fiona Brennan and Tom Downs, and a really big thank you to Richard Thomas, who helped start this network as well, and who is a GP from Swansea who's been working very, very hard in terms of the inhaler prescribing to really change that for Wales. So thank you.
Awesome, Sarah. Thank you so much for taking us through all the work you've been doing in general practice. And you highlighted the importance of focusing quality improvement projects on the carbon hotspots, so the big wins in the NHS. And yeah, it can feel really overwhelming at times, can't it? But there are many simple changes that we can make individually that can have massive benefits when we work together. So next up, we have Kathrin Thomas. She works as a GP and a public health consultant, and her focus has been on disadvantaged localities and addressing inequalities. She's chair of the Wales for Africa Links Network and is an honorary lecturer for the Masters in Public Health and Health Promotion at Bangor University. Thank you very much, and over to you, Kathrin.
Thank you. Oh, well, it's great to be here. Thank you very much for the invitation. I feel a little bit of a fraud. I'm inspired by what everybody has been doing in terms of organising. You're just amazing. The reason that I'm here was as the Wales Africa Health Links Network. We've been in existence since 2006, and we started as a very informal network for people who are working in partnerships between institutions in Wales and sub-Saharan Africa, and I'll explain a bit about that later. But we have an annual lecture, and last December we invited Professor David Pension to give that lecture to explore the kind of synergies between climate change activism and global health. So that turned out to be a 2-hour session online, and we had politicians, we had NHS, senior people from the NHS, a lot of debate. So if you're interested in seeing that explores some of these issues in greater depth, I'll give you the link at the end. So for me, there was a lot of learning in that, and that's when I met Amarantha and Fiona. So and heard so much about what was going on in the last few months. So I have to, you know, full respect. It's amazing what you've done in a short space of time, and I'm just delighted to be here. I'll go on and tell you a little bit about our network and where it's come from. So when we talk about what's the kind of connection between global health and us as health workers, you know, what is our role as health workers in terms of sustainability and addressing the impacts of climate change, and what can we do in our work here in Wales? But how does that fit in with our role as health workers in a global network, you know? So what we've talked about a lot this morning is about first do no harm, and that's a principle that we're all very familiar with, and that's what we're talking about, the way that we do our practice. First of all, we do not want to cause harm, certainly not to public patients, but then looking at future generations, the way that we do our practice. And I'm not, you know, you've heard everything that we've talked about today, and I've learned some of this for the first time in the last few months. But to go on from that, what do we do in terms of our role as health workers in actually doing some good? So we've talked a lot in Wales about global citizenship, and the Wellbeing of Future Generations Act has given us a really good framework there, and global responsibility is one of the wellbeing goals. So Wales has a long history of progressive internationalism. We as a government since 1999, Wales has always been interested in engaging globally and doing its part as a global citizen. So we have had since 1999 devolved powers. Health has been entirely devolved. So there's so much that we can do in terms of the healthcare system here. But international development is not a devolved function. So the Welsh Government has no powers and it has no budget for international development. However, in 2006, the Welsh Government decided that they were going to do their bit and focused on sub-Saharan Africa. So there's been a Wales for Africa, now called the Wales and Africa programme, since 2006. Which the Welsh Government has always put a budget towards that through the First Minister's office, which has supported largely civil society in engaging with partners in sub-Saharan Africa. And the main themes of that have been around sustainable development, climate change and the environment, as well as lifelong learning and health. So that's always been an integral part of the programme, and there's been lots of overlap between activity in all those areas. The fundamental part of that has been a grant scheme, so that any institution that's taking part in health activities with sub-Saharan Africa, particularly around climate change, lifelong learning, health, sustainable livelihoods and so on, can apply to that grant scheme, and that comes out 2 or 3 times a year. So, you know, I'm very grateful to Welsh Government for the long-standing support that we've had. So in terms of climate change and Africa, these are some of the statistics from the World Health Organization, and it's probably not a surprise to anybody that the impact of climate change is going to be felt by some of the most vulnerable countries, and the ability to mitigate against some of those impacts are going to be less than we have here. So, and Sophie described this very well this morning, you know, the determinants of health, clean air, safe drinking water, secure shelter, are going to be most affected by the climate crisis. And in sub-Saharan African countries, they're extremely vulnerable because some of those things are already not, you know, really difficult for people to access. Employment is still very much in the agricultural sector. So again, the impact on income and ability to care for your children and look after your family. And then the part that we are most interested in is how do we help in the mitigation against that? Because if weak health infrastructures are already being overwhelmed, and we've seen that in particular with the COVID-19 pandemic, that it doesn't take much to overwhelm your health system. So we need to be able to do our bit in supporting weaker health systems, particularly in terms of prevention and protecting. We're not talking about high-tech healthcare here at all. We're talking about how do we support and share skills around prevention, protection, and primary care, universal access to universal health coverage. So our kind of duty as global citizens, as much as getting it right here and how we do our practice here, as health workers, we do have that opportunity and that duty of care, as David Pynchon so clearly put it this morning. So I just wanted to highlight, I've got 2 slides here just to compare kind of needs with the supply. So we already know that health is very unfairly distributed. So I've just picked just one metric here, which is healthy life expectancy. So what is your chance? What age are you likely to live to before you start getting poor health? And in most of sub-Saharan Africa, that's less than 50. So that's a combination of people dying young, but also getting ill at the younger ages. So there's a double whammy of high infant mortality, high maternal mortality, and infectious diseases still, while at the same time, the growing impact of non-communicable diseases. So it's really unfair, the distribution of health, as we know. And then in response to that, this is a map that kind of shows you diagrammatically the size of a country is related to the number. So here we're looking at the number of doctors, nurses and midwives per 10,000 population. And you can see it distorts the size of countries quite significantly. You can see that the UK is actually much larger than it actually is. We do have a very high number of health workers per head of population. And again, sub-Saharan Africa it's got tiny numbers, and there's an inequality within African countries as well, but you can see quite dramatically there. And we heard this morning, Helen put it quite nicely, that it's the people in the system who are best placed to change the system. And David Pynchon said, don't do nothing, you do have a duty of care. Well, we're talking here about health workers like ourselves, clinical, non-clinical, who are in that system, but in other countries, they have so much less capacity and just dealing with the day-to-day. And we have that capacity. We have resources, capacity, skills, knowledge. That there is something about, can we do a little bit to rebalance that awful inequality? Can we do something about, for instance, health workers who migrate? We have a high proportion of migrant health workers and social care workers. England can tell you how many health workers they have who've come from other countries and qualified in other countries. But in Wales, we don't have that data yet. HEIW cannot give us that data. So at least we need to understand how many diaspora health workers we have here in Wales. How can we turn that into a win-win? How can we support them in the communities that they've come from, and do our bit to not just take, but to give back again? So one way of doing that is partnership working, and that's very grassroots. It's people like you and me talking to people like you and me doing the similar job, but in resource limited areas. So across Wales, we've identified about 38 active partnerships, some of them within the NHS, some of them in academia, but most of them are actually voluntary organisations, although many of them are run by people who are working within the NHS. So that movement has been going on for many, many years, and we've tried to kind of support and build on that the NHS has signed up to a charter for international health partnerships, which also includes wider things like recruitment and retention of migrant health workers, and just good governance and good practice around how we do development. That in itself has been a challenge in the last year or two in response to like the Black Lives Matter movement. How do we do aid in a way that's actually equitable, where there's power sharing, where we understand and we work together, and it's not done in a neo-colonialist way. So our practice has been really challenged in the last year for many reasons. One of the things that we've really been thinking about for some time is how we do this partnership working, because the model has very much been people getting on a plane, flying somewhere and delivering training, particularly train the trainer training. That has been the capacity building model that's been the most common. And we've challenged ourselves a lot already for some years on how we do that. So there's been a much greater move towards digital communication and online learning, and doing that in a more effective way rather than getting on a plane. But this last 18 months has obviously challenged that, and partnerships have been really innovative in how they have risen to that challenge, which has had the benefit of reducing our carbon footprint significantly. So we hope that we're doing our bit. And I just thought I'd end here on just describing some of the practical things that partnerships are doing. So I'll just highlight a few. One of them very recently, the Royal College of Obstetricians and Gynecologists has had a programme for some years, which is at the moment on hold formally, on making safer choices. So that's about contraception and abortion care. So there is one of our trustees has delivered that course, which was designed to be a week-long, face-to-face, very practical course around delivering abortion care and contraceptive care. They've delivered that online over a week with colleagues in Zambia. So that's to quite senior colleagues in a train-the-trainer model. And that was the first time they'd done it entirely online. They sent over the obstetric model, so it was actually workshops and clinical skills teaching that was done online and went better than they'd expected. So we're moving more and more to be able to do that kind of support for colleagues in low income settings. Then a project that grew out of the Staff Wellbeing Support Service in Betsy Cadwallader University Health Board, and those of you who work there might have come across it, which the clinical psychologist ran during the first COVID wave, and then it went on until just before the second wave, where staff could access a clinical psychologist, book an online one-to-one or group support, and the clinical psychologist did exactly the same model and offered it to doctors in Lesotho, and the feedback from that was hugely positive, that doctors in Lesotho, because they're working in rural areas and have a huge amount of responsibility, leadership management responsibility, as well as clinical responsibility, felt very isolated and had a high level of anxiety and depression. But this project, the ability to talk to somebody outside, and it turned into kind of almost a leadership coaching model as well. Really good feedback. So that's something that we're going to explore. And then increasingly, there are things like virtual volunteering. So if any of you are interested in virtual volunteering opportunities, if you look at the Tropical Health and Education Trust website, there's several opportunities there now for virtual volunteering in Zambia and Uganda. So models like that, armchair volunteering, rather than actually having to get on a plane and go somewhere. And then models that are using technology. So Ariane Teleheal was set up by a refugee doctor from Afghanistan, who through smartphone use supports doctors in conflict zones. So initially Afghanistan and then Yemen, and he's recently also helped out in India with the COVID crisis. So doctors on the ground can send a query through to Ariane Teleheal, and there's a network of about 400 volunteers globally who will come back with a suggestion, so interpreting maybe an X-ray or a clinical query, and they now do a lot of online teaching and have a whole library of appropriate learning, e-learning that they've developed through that. And Zambia, there's a fantastic project called the Virtual Doctors, with the medical directors based here in Wales, in Brecon, and they support clinical officers in remote areas. So again, through a handheld app, being able to ask queries so that they don't have to send patients many, many miles to a referral centre. They can manage queries and questions and get support where they are. So that's increasingly happening. So in terms of how we can support health workers in other countries, these kind of digital ways of working are going to be the future. So if you'd like to know any more, we do have a website. I'll put this in the chat afterwards. There's a Wales and Africa Health Links Network website. We are supported by an organisation called Hub Cymru Africa, which supports all of civil society that's active in this area. And I'll also put the link to the lecture that Professor David Pension gave, which explores this in a lot more depth. So, but anybody who's interested is very welcome to get in touch with me directly. And I just have to say thank you so much for inviting me. I've had such a brilliant morning so far and learned so much. So power to your elbows. Thank you.
Oh, thank you so much, Kathrin. You've shone a light on how the environmental and climate crisis is very much a social, global and racial justice issue. And I still find that map that you showed staggering to look at. And thank you for giving us such practical tips of how to get involved with health partnerships and to make a difference across the world. So next up, we have a Q&A session. Yasmina, I've got one for you, if that's okay. So many high usage consumables have packaging that does not lend itself well to being recycled. When all Wales contracts are awarded, this should be a fundamental point to know and judge upon. Building upon this point, why can't the big companies being pressured into using sustainable packaging, or will Wales move to other projects?
Yeah, it's a big challenge, definitely, and I think there's a few points to note from here. As has been mentioned previously today, procurement is one of the big areas we do need to focus on when we talk about sustainability, and I think it goes back to engaging with the different departments. So from a medicines packaging point of view, we need to engage with procurement and we need to engage with pharmaceutical industry. And I think there is a growing number of pharmacists and pharmacy professionals who are passionate about the topic and who are trying to sort of build up that network and liaise. And we need to sort of demand from our suppliers that this is what we as consumers want. We want packaging which is more environmentally sustainable, and we want to work on it. And I think as consumers, if we ask for it and if we choose to purchase those things that are more sustainable, and that change will come.
Yeah, definitely. Okay, thank you, Yasmina. Tom, where did you find your best allies when starting your project?
So my best allies were the other junior doctors initially, because you're all in, like, this is before COVID now, so we were quite lucky compared to the following set of junior doctors who've all been in isolation, but we're all together in the junior doctors accommodation. So we're just taught, so those are my allies initially. Then it's been everybody and anyone. It's been so surprising who people I wouldn't have thought would have been been consultants. It's been across the board really, and non-clinical colleagues as well, people in estates, environmental officers. So there's just so many people and people in procurement. So yeah, just start those conversations, and it's important to initially find your allies. I think that's why the board that we set up in the hospital was quite good initially, and from that then you've got engagement straight away with the people that were really keen to get involved. I don't know if Yasmina would want to add on anything.
Yeah, I think it's, as we said, I think Tom, you've said most of it. It's reaching out to colleagues in your department, and as we alluded to in the presentation, it is a vulnerable place to be at the start when you are bringing up a new topic perhaps, but you will find allies, so reach out. And these days there's lots of people interested in the climate crisis because it's going to affect us all.
Okay, great, thank you, Yasmina. So this is to Farzad and Alex Morgan, if that's okay. So we know that Entonox and nitrous oxide are damaging to our environment. So why are we not looking at phasing these gases out across Wales and for more sustainable gases?
Should I start? Well, I think we are, and I think Amaranth has done some incredible work over the last year, which I'm sure you're going to see soon, and it's really interesting looking at where a lot of our nitrous goes, because I think a lot of it comes from leaks in the system. So there's a lot that can be done through engagement with actually facilities in the States. In terms, certainly that was the case at Cardiff. The reason it wasn't our first project at WEAN is simply, it just, in terms of ease of doing the project, there's so much to do that there's so much low-hanging fruit. We pick the low-hanging fruit first. Nitrous becomes a little bit more complicated because it's not just used on anaesthetic machines. It's used in A&E, it's used in cylinders, it's used in obstetrics. So it definitely is, and to be honest, it's the next thing I think Alex has said. It's one of the things we're looking at next. So it is, and you're completely right. And that's just one of the next things that we need to be doing. Like I say, work is already underway, but if you're looking at getting involved in a project, I think that's a really right project with a huge amount of potential sort of carbon impact that can be done. And like I say, it's really surprising. Maybe Amaranth will later today allude to her work a little bit more, but it's really surprising where a lot of our nitrous goes, and it's actually often not into a patient's lungs. But yeah, I'll let Amaranth or Stacey talk about that more if they get the chance.
Alex, do you have anything else to add to that?
Why we chose DES first was A, Farzad was already working on it, and B, when you look at the impact you can have with just desflurane, and it's a no-brainer. There's no real clinical benefit necessarily to using desflurane. There's a future problem that you're creating, and desflurane is incredibly expensive compared to a completely reasonable alternative. Nitrous historically is quite embedded in our use, so you actually have to have quite a lot of conversations with people to get them to change, whereas the evidence for DES is a bit of a no-brainer. So yeah, as far as I said, we were going for low-hanging fruit, which was quite difficult for people to argue against.
Thank you. So Sarah, this one's for you. So this is on social prescribing. How do we link local environmental groups and projects in with social prescribing with local GPs? There are different systems and databases, and those groups are finding it confusing or labour intense. How can we make this easier or bring consistency? We are looking at this through the public service boards at the moment in North East Wales. Are there contacts to make?
Yeah, so I think that's a really good question, and one of the key questions when I started green mapping for general practice was how social prescribing is linked in, and everything you've said there is everything I've found. It's confusing, it's different between different health boards, there are different arrangements where social prescribers sit, what their background of training may be, whether they're in the sort of mind charity sector or an NHS or GP primary care sector. So how do I answer that question? I think it highlights the need to bring it much more on the forefront of access and awareness, and there are some GPs in some areas of Wales that seem to know their named social prescriber and know those links, and there are definitely areas of Wales where a lot of GP surgeries would not have a name or an understanding of social prescribing or where to direct someone. So I think it shows from a Greener Practice Wales GP network how we need to bring those areas that it's working to those areas where perhaps it's a bit absent. And I think I would say from a first point of call, go into your, if you're in an area, go into your local GP surgeries or get some time, or sort of PLT sessions or lunchtime sessions, and try and actually just get in there. I know COVID is a little bit hard, but some form of e-learning face-to-face, and ask your GPs, are you aware of it? Do you know who is in your local area? Do you know how to signpost or what you can do? Because already, once I started being aware of my local social prescriber or services outside of it, I would say I actually was able to prescribe less, because I was able to point people towards some more local activities. So you're talking about all sorts of stuff, from paddle boarding in Cardigan to beekeeping in Carmarthen. I mean, it's amazing what's out there, and when you know about it, it's quite addictive, because you'd much rather send a patient that way and give them a plan than give them, I don't really know, I've got limited options, do you want me to prescribe something? So yeah, I would say go and talk to your GPs, see what they know, and if there is an absence there, then roll out an education project or some sort of something so you can take there with details and let them know.
Okay, great, thank you, Sarah. So I just one last very quick question for Kathrin, if possible. So someone said, great presentation. Do you have experience of helping increase digital inclusion for those in sub-Saharan Africa?
Yeah, I mean, it's a big issue, isn't it, here, digital inclusion, yeah. We have found across a lot of sub-Saharan Africa that they've done the jump. They've missed out the telephone system, and landlines have gone straight to smartphones. So we found that the health workers that we most of our partnerships work with would all have a smartphone, but there are still challenges in terms of getting access to internet, which is not, you know, sometimes it's a bit patchy, but often it's better than some parts of North Wales. But also the data, you know, people are paying for data, and that's been a big barrier. So it is an issue. So in terms of the health workers we engage with, with partnerships will often find that they're funding data, but they're also funding some of the equipment like laptops that people will need. So yes, we do our best, and that really is a very recognised barrier that we are increasingly now dealing with. So the funding is moving from spending money on flights to spending money on tech and data.
Thank you. So that brings the Q&A session to excuse me, to a close. Thank you all so much for your brilliant answers. So I'm handing over to Amarantha again for the rest of the programme.
Thank you so much, Stacey, for looking after that session with our fantastic inspirational colleagues and their projects. That was really lovely to hear from people who have been putting this into their work, maybe without support from the beginning, who have garnered support throughout those projects. I would like to say a huge thank you to those session 2 speakers, and hopefully you're listening and feeling, as we had hoped at the beginning, positive, inspired by the bigger picture, confident that you do have a role in the process, however big or small, and wherever that may be within this humongous system of our healthcare. And most importantly, that you feel empowered by the steps other people have made, that you too can make those steps. If it seems overwhelming, and believe me, that is exactly how I felt at points this year, and my job title is Fellow for Sustainable Healthcare. Believe me, you're not alone. So what I've done is I've put together a few easy actions to make to engage in something called active hope. Active hope is something we do rather than have. It involves being clear about what we hope for and then playing our role in the process of moving that way. So all the actions we've kind of drip fed you and suggested throughout the day are going to be presented quickly just now. So we started at board level. What can we be asking of our executive directors? We can be asking, as we've discussed in the chat, where is the board level representation? If we're demanding it, they're more likely to listen. Where does sustainable healthcare sit in governance? Does workforce planning allow time and resources for this work? Well, we've heard that without the strength and pushing of these people to get it on the agenda, it might not happen. And what's being asked of quality improvement teams? Do they even know about sustainable quality improvement? Can health boards support things like scholars with funding and dedicated time? Because we appreciate not every health board has a fellow like me, indeed none of them do. And how can we incentivise and reward these sustainable projects? So the Centre for Sustainable Healthcare runs a Green Ward competition, and that is about celebrating all this work that's being done and rewarding those people who have made great strides. If you are making financial savings and you're proving it by your research, can you request circular funding? Where is that money going to go that you have saved the health board? Is it going to go back into the project you've provided them with? and therefore will support your next project moving forward. And as we've mentioned, if 62% of NHS Wales' carbon footprint is caused by what we buy, can we influence what we buy? We need to be talking to procurement and asking those questions from our executives. So let's take a step down. Could you lead the change? Could you become a Green Health Wales representative or seek out a group that already exists? Could you find your specialty network on the Centre for Sustainable Healthcare's network sites? I think they are about maybe up to 15 now with different specialties. Can you organise educational sessions, like using this in your departmental teaching session to play some of our recordings and have discussions about them? Can you adapt Project Drawdown or other exemplar projects you've heard today in your place of work? Can you take your ideas and progress with a SUSQR project of your own? Can you look at the Bevan Commission exemplar application and see if the support they're offering you is something that would help you push forward? And there are so many courses out there. We've got an entire page dedicated to learning more about this topic on the Green Health Wales website. And also, if you'd like to become that representative, we have a specific link for you to get involved on the website. If someone could pop that in the chat for me, that would be really helpful, just to put your name forward and any skills and talents you may have to help us in this voluntary grassroots venture. And lastly, we've already mentioned, collect your colleagues into a green group, get you all into a socially distanced area, and have a coffee in your sustainable reusable cup. Just a few small ideas. A next step down, have even checked that your health boards declared a climate emergency? Do you have a sustainability officer? Cardiff and Vale have released a job description application to secure one, making sure that the projects across the breadth of clinical, administrative and support services are all on the radar and getting the right people in the right room talking to the right collaborative departments that they need. What sustainable action plan has your health board published? And could your health board affiliate with something like Healthcare Without Harm? Cardiff and Vale has done so this year, which means we get access to free resources, free seminars, free international collections of people getting together under the guise of Healthcare Without Harm. And does your QI lead, there we go, Freudian slip, does your QI lead know about SUSQI principles and projects just within your department or within your directorate? And have you submitted your thoughts via health board feedback or staff opinions, which is really important. Our execs do listen to those feedback forms, and are you telling them what you would like to see? And lastly, even smaller, these really small actions, if all of that seems a bit overwhelming, pop on our website, maybe look at there's the free e-learning module. It's being run by HEE, but all UK-wide NHS staff have access if you sign up. Just have a read through of all the exemplar SUSQI projects we couldn't speak about. There are loads of different types of resources I'll mention in a second that are beyond webinars. And check out the Planetary Health Report Card to see how your university did. You can be inspired by other international projects, use your study budgets on education focusing on sustainable healthcare, and even look at some postgraduate courses in them. The exciting resources we've got available on the website, all of these are hosted up there. Things like podcasts, books, TED Talks, documentaries, videos, free courses, the decarbonisation strategies, obviously, and a free lecture series by the Royal Society of Medicine, freely available on YouTube, talking more explicitly in depth about different specialties and the impact of the climate crisis on them.
So I see today not just as a day to launch the network, but to create the network. And I think it's really important. There's a lot to take in today that we start to think what we want to do going forward. As a small team, we've already started to brainstorm about some of the upcoming events that we're hoping to be involved in. Some of them are already timetabled in, some of them have got dates to be confirmed. So as we mentioned earlier, our Green Group is going to do a webinar on how to set up a hospital Green Group. That will be on the week of the 13th of September 2021. WEAN, the Welsh Environmental Anaesthetic Network, are doing a webinar on how to set up a national network like they have. They're doing a webinar on Tuesday the 2nd of November. And then we're hoping to have some networking meetings just to keep the conversation going and to support each other on this ongoing journey. We're hoping to get feedback from people on the day to try and figure out how, because I know everybody's very busy and it's difficult to fit the time in. It's a lot to take in. So we need to figure out the timing and frequency of those and scheduling some meetings, and we can just support each other on this journey. There's going to be a Cymru launch of the Lancet Countdown. So that's the annual report of the connections between public health and climate change globally. And there'll be a Wales launch of that we're hoping to collaborate with the Lancet on. So that will be the week of the 25th of October, 2021. the specific dates to be confirmed on that, then we can plan an event and discuss the outcomes from the report and the key findings. Then the Welsh Government's doing their version of the UN Climate Change Conference, COP Cymru. At the moment, they're looking for feedback on the date for that. So it's looking to be either in the weeks before the International Climate Change Conference in Glasgow. So it'll be late October, early November, and hopefully we can be involved in formulating the programme of that with some events from Green Health Wales. So anybody who wants to be involved in that, get in touch with us. And then finally, Clean Med Europe is Europe's yearly sustainable healthcare conference. So the dates for those are the 29th of November to 3rd of December. And I also just want to highlight, again, the Bevan Commission, they've got an event tomorrow showcasing some of the work of the exemplars across Wales. So if you have got some time tomorrow, have a look and join them. And also the Centre for Sustainable Healthcare, who's been co-hosting this event with us, they also have plenty of talks and trainings, and you can find out more about that on their website.
Thank you so much, Tom. And finally, we have a few advocacy groups who are doing lots of the hard work to get this on the agenda. And there are also some research groups that we have already mentioned throughout the day. And like I said, all resources available on the Green Health Wales website.